welcome back to Community Conversations with the UI Cancer Center. I'm Chris Gay. I'll throw up our title slide. Community Conversations is a weekly show hosted by the UI Cancer Center where we highlight our different community partners, our different UI health partners, and any of our interventions or programs that we have going on at the Cancer Center. Our aim, built around the UI Cancer Center's bench to community model and community focus model, is to disseminate educational information and other health information to the community. Our guest today is Dr. Angela Odoms-Young. Thank you for joining us.
Thank you for having me.
She's the Associate Professor of Kinesiology and Nutrition and Associate Director of Nutrition for Ocean at UIC. Today, Dr. Young is joining us to discuss dietary behaviors, diet-related diseases, and how they relate to different diseases and cancers in our community. Again, thank you for joining us.
Yes, thanks.
So we'll just start. So can you tell us a little bit about your role at UIC, maybe your role at Ocean, and with your research?
So as I mentioned, or as Chris mentioned, I'm an Associate Professor in Kinesiology and Nutrition at UIC, and then also the Associate Director for Nutrition in the Office of Community Engagement and Neighborhood Health Partnerships. At UIC, I kind of wear two hats. One is my research hat and teaching in the department, where my focus is primarily on health disparities, particularly cancer disparities in cardiovascular disease. So the focus of my research is really on those diet-related health conditions. My teaching as well is centered on really educating students and training health professionals on how do you develop interventions in the community to really address those diseases, particularly around prevention. My role in Ocean, the Office of Community Engagement and Neighborhood Health Partnerships, is very similar. Primarily, I work with a project called the Chicago Partnership for Health Promotion, which is a nutrition education funded through what's called SNAP Ed. And we target families that receive food assistance or low-income families to really support them in healthy eating and physical activity. And again, in that hat, although it's an outreach, sort of the outreach part of my role in UIC, is still looking at bringing kind of evidence-based interventions to communities to help address chronic disease and different health issues that face the community.
Fantastic. Well, it's I think it's perfect having you on, especially one of the Cancer Center's focus is health disparities, and a lot of our interventions and programs are focused around addressing cancer health disparities. Can you elaborate a little bit on any research you're doing right now around disparities or prevention?
So many people are becoming more aware about the role of diet in cancer. Even in the early 80s, we started seeing research about the importance of diet and dietary behaviors in preventing cancer. One way that people can reduce their risk of cancer, as well as other chronic health conditions, is through healthy eating. But one major factor that we know now that we didn't know as much in the 80s that affect people's dietary behavior is their access. So there's some work that has emerged that indicates that your zip code may play a bigger role in your health than your genetic code. So when we look at things like racial segregation, we look at low access in certain communities, much of my work is really understanding how access impacts dietary behaviors. But kind of beyond that, how can we address and improve access? People talk about access to stores or community gardens or farmers markets. We know that if it's not there, then you can't eat it. So part of it is really looking at how do you work collaboratively with communities to increase access. So we have a few research projects that's related to that. We have some projects in collaboration with a community-based organization called the Inner City Muslim Action Network that we've been working on accessing corner stores. And we also have a project where we're targeting families that receive food assistance that participate in the women, infants, the supplemental program, nutrition program for women, infants, and children. working collaboratively with the Illinois Department of Human Services to think about how do you improve retention and make sure people have access to food assistance. And then we have other projects, as I mentioned, in Ocean, really nutrition education projects, as well as kind of community intervention projects, a food systems project on community gardens. We've worked in collaboration with other organizations across the city. So the goal is really to understand more about how people can live in an environment where the healthy choice is the easy choice.
Right, and sort of going into access a little more, because I think it's fascinating to think that education is a huge part of it. Understanding like what, for us anyway, at the Cancer Center, what about all these different cancers, what they mean for your family, for your life. But it also seems, if you could maybe elaborate in this, it goes hand in hand where you not only have to teach people about the education, about food, what's healthy to eat, but also, where you can get these things, because it's, education, I guess, isn't as useful if the actual, the tangible things aren't there. So is that access included in, like supermarkets and that sort of thing?
Supermarkets, corner stores, farmers markets. And I think it's twofold. One is because many people, if you look at, and we work primarily in communities of color, when you think about the families that live in South and West Side communities, I'm a South Sider. Many people are knowledgeable about some of the things that they should eat. I mean, nutrition education is an important part, but you do have increasing number of families that have an interest in living a healthy lifestyle. So I think the goal is to support that. We have to make sure that people have the knowledge, but we also have to make sure that they have access, that they have income. So it's not only looking at just, do I know that I need to increase my intake of fruits and vegetables? It's, do I have fruits and vegetables in my community? Do we have economic development to make sure that people have access to jobs in their community? It goes hand in hand. It's not just sort of one aspect, but when you look at healthy lifestyles and how we support healthy lifestyles, is taking a holistic perspective to community development. I think the other thing that's important about that when you look at health disparities is that we know other things like chronic stress, as well as, and I mentioned issues related to income, that they can really put stress on a family where they have it may be difficult for them to lead a healthy lifestyle because of that external factor. They may be facing multiple challenges. And so it's important that even though we think about diet and cancer, that we also think about those external factors. How do you reduce stress and burdens and challenges that families face by providing more access to resources in addition to the education so families can lead a healthy lifestyle.
And a term we've used at the Cancer Center that I think is applicable is like the social determinants of health.
Exactly.
What are the different aspects in your life outside of just, going to the doctor and making sure you checkups and all those things that affect your health, to do with stress, healthy eating, all that kind of stuff.
And that's actually at the core of my work. It's really around social determinants of health, and then how do you promote health equity? Because it's really bringing health to where people live, work, play, shop, worship. So we know that health happens every day. It doesn't happen just in the doctor's office, particularly when we are talking about prevention. Right.
And actually health equity is another, huge goal of the Cancer Center. There's actually two projects working on right now, Chicago Check, the Chicago Health Equity Collaborative, and our GUIDE project with Governor State University, both focused on, health equity in Chicago and in the south suburbs. And what I want to ask you a little bit of is, when thinking about health equity and how, if we're talking to our community, how do you think they should frame in their lives health equity when they're thinking about it? Because I think we talk about it, academically a lot, and it's sort of from an above point of view, but How would you sort of frame it for the community?
I think that's a really good question, because how does that translate is so important, because on the academic side, we only play, and I don't want to say we play a minor role, but we only play one part of that role.
The greater
Is
scheme, right.
we need to partner with communities and policymakers, and I think families can do things like advocate. Community organizations can advocate for change within their communities. And if you look around Chicago, there's a lot of very, very strong organizations that are advocating for changes and differences within their community. Because most people think about health as personal responsibility, but when we think about the social determinants of health, it goes beyond that. So how do we engage in advocacy as well as understanding the policies and supporting those policies that help people lead a healthy lifestyle? I think as far as families, and I hate to, sometimes families are facing so many challenges, and then we want to place the burden on them to be the main advocates. And I think one of the things that families can do is actually connect with other families. And when you have that support, and also connect with community organizations that can help, where you can learn about some of the issues, but also when families connect with other families, either through the, schools or through child care providers, really that helps strengthen the whole system through churches. So people are coming together to look at how to address issues, as well as those are places that they can also get support to help them deal with some of the challenges that they face. Families in Chicago are facing very serious challenges with the community violence, with other things related to, jobs and income. And so it's so important that families also get support from other families as well as our organizations. And that helps promote social networks, establishing strong social networks is also a pathway to equity.
Right.
And community cohesion is a pathway to equity. Social capital.
Right.
Those things are kind of buzzwords, but those are when families connect with other families, and when organizations connect with organizations, and families and communities come together.
And even thinking about, sort of social capital, but also this, the idea of equity, it's not, some of all the issues that I think our families in these different communities face, sometimes it can feel like they exist separate from one another. And even when we're thinking about cancer, something we're always trying to promote is that, it's the and conversation, that, cancer, while, being an issue in a lot of our communities, and sort of there's a disparity that exists across Chicago, it does play into other aspects of your life, and other things play into cancer. It's sort of like, it's not that all the social determinants, as we're talking about them, affect you by themselves. They, sort of all mix and create, they're not singular. And so it's definitely thinking about community organizations, social capitals. It's ways to give yourself those resources to address, not only this single aspect of your life, but sort of a wider array of things.
And I can give actually a couple of examples of that when we think about cancer. Most of my work is prevention, but recently I've been interacting with some of the organizations that focus and center on survivorship. And there's a few like Sisters Working It Out, those organizations that are looking at on the survivorship end of cancer, because we know it's not only prevention. When we think about disparities, we also have racial and socioeconomic disparities in survivorship. So those organizations, Beyond a Mammogram, Sisters Working Out, it's another organization. I can't remember the name of it, but they're located in Hyde Park. The focus of these organizations are really bringing African American women together that are disproportionately at risk for, a shorter survival after they are diagnosed with breast cancer and they receive treatment. And really that's looking at, having that social cohesion, bringing people together to share information. So you do have many organizations that are focusing on how do they mobilize, how do they look at policy, even around issues associated with survivorship.
Yeah, and actually our last week episode was about survivorship, sort of a grander look at, we have an event coming up focused on survivorship, their survivorship celebration, which I'll talk about a little later at the end of the episode, but also thinking about sort of like the different aspects that go into your health even at that stage, that it's the whole, we were talking about the sort of care continuum where, there's not only from beginning to end of your care, but also all the aspects that go into your life outside of care. It's, fascinating really that it's all people are thinking about the whole picture, and I think for the community, we find that that's how, the community is constantly thinking, and how I think we need to continue the evolution of our thought is that, our community members and our community partners help us realize the whole picture and the things that where the disparities and the gaps exist. Even thinking about survivorship, I mean, it's people know about the cancer disparities themselves, but that there's a disparity even after cancer is fascinating.
And diet and healthy lifestyles, if we come back, we think about the big picture, but then when you even focus in again, diet and healthy lifestyles are in obesity and management of comorbidities like cardiovascular disease, diabetes, hypertension. Those things become really important again when we think about survivorship. So on both ends, healthy lifestyles are part of that continuum, and then how do we support those healthy lifestyles continue to be important when we think about health disparities and promoting health equity.
And sort of thinking about that too, about different groups and partnerships. Are there any resources that you've used through your research or even through Ocean that would be good for our community to know about? Just thinking about sort of health equity in one pocket, maybe even diet or survivorship, whatever. I mean, you did bring Sisters Working It Out. I know Imran's Angels is a big partner of ours who works on survivorship, but also education. What other resources have you found and used that have been, good for the community, you think?
I think some of the, and it all depends on which bucket we focus on. There's many community organizations across the city that focus on community engagement, community organizing. I mentioned the Inner City Muslim Action Network. I know they have a program also on CAN TV, phenomenal organization, RAGE, the Residents Association of Greater Inglewood, that do phenomenal things in Inglewood, Teamwork Inglewood. There's several organizations across the city, and I think about many of the communities that we focus on in Lasse and Little Village. I mean, it's just so many. I think it's Austin coming together because through Ocean we've been working with Ruth Kimball, who organizes their child care efforts, and phenomenal group that's mobilizing and bringing together home child care providers in Austin. I think when you look at the university and the Cancer Center is really here as a support and a partner. People working boots on the ground every day within their communities, they really are at the forefront, and we think about how do we partner with them, how do we bring informational resources. So a lot of the work that I do is related to that. When it comes to nutrition resources specifically, sometimes people they face a lot of barriers to accessing food assistance. We also partner with GCFD, which is our local food bank, and looking at ways to support families that don't have access They also do a lot of advocacy work when it comes to looking at access to food to make sure that people have food assistance. But GCFD across Cook County is really one of those backbone organizations that when you think about food assistance, like SNAP, WIC, those are other things, Catholic charities that support, but we partner a lot with the Greater Chicago Food Depository.
Great. And thinking about sort of that next step as well, I mean, those, the next to dietary resources, I guess, and also, I guess, taking it back to cancer a little bit, are there any sort of things that you can tell our community that are useful to keep in mind as they're approaching, like, access, as they're thinking about, like, and tying it to sort of greater disease management as well? Sort of anything useful you can tell our community, and like when you're looking at these resources, these are things you should look out for, things you should keep in mind that can help you prepare sort of through your health journey and everything as well.
So I think at an individual level, and that's where families coming together and sharing resources. There's many organizations, including the Chicago Partnership for Health Promotion, that offers nutrition education. And we partner with EverThrive on a program called Cooking Matters. So teaching families how to prepare food. I think those things are really important to make sure people have the knowledge. There's things happening in schools, as I mentioned, in child care. So part of the first step in thinking about your health journey is really, even though knowledge isn't it, knowledge is a part of it. How can you use the internet? How can you connect with others to learn more about what's healthy eating? We all know that we should eat fruits and vegetables, but sometimes we don't know as much about how to prepare those fruits and vegetables, particularly when we look at some of the things we might end up getting access to that we're not familiar with. That even happens with me sometimes when I get an eggplant or, desert squash or things that, so I think that's part of it. The other part is really making sure that you are, when it comes to families in those institutions, many times we could connect with schools, as I mentioned, child care, churches. How do we come together within our institutions and think about how do we support each other as families? And then we can't leave out other like traditional healthcare institutions, like we have Mound Square or Access or other places where we get health care. They also can be a resource. Those local federally qualified health centers, other health centers and institutions. So I think at an individual level, we can really think about what we can do to learn more. But I would say my biggest recommendation to families is just to start small. Do one thing. You don't have to feel like you have to conquer everything. Maybe just do one thing. How do you add more fruits and vegetables to your diet? How do you put, in the morning, adding fruit to cereal, adding a vegetable to a stir fry, or part of it is really starting small and then looking at how you can connect with others as well as support policies to help really move things so the healthy choice will be the easy choice.
Fantastic. I mean, I think that was a beautiful way to wrap it up. I mean, it's so I'm thinking about, again, social determinants of health, and thinking that, like, all aspects of sort of this health continuum, not only the diet and cancer health and prevention and making sure you go to the doctor, it's all sort of equally important and equally valuable. And thank you for bringing all that to the table. It was really fantastic. If you have any questions about anything we talked about today, or any questions about the Cancer Center overall, you can contact us at the contact information you see now. You can call us at 312-996-8503. You can visit us at our website at cancer.uiillinois.edu. We have a Facebook page you can post on, and we'll reply quickly. If you have any questions for any of our guests, including Dr. Odoms-Young, you can contact us, and we'll make sure to connect you with the best information you can. Once again, this has been Community Conversations. Thank you so much again for joining us.
Thank you.
We'll be on next week. Thank you very much.